normal intellectual way. Right now the skin up here,
Wearing my guts.
pardon? Yeah, I need a finer faucet. Finer faucet. Because it's a bit slippery. I still can do it. Okay, I'll show you. No, man, okay. No,
Oh, I
man.
found it. This is color faucet.
Yeah, can. Yeah. See, when I make a little slit there, then I can. You see, this is the outer layer skin. Okay, I can just go through like this. Normally, we'll go through until the upper end. Of course, when it becomes very slippery, then you can use your forceps. Okay. And then we should be doing the other side. Technically, we should be able to move this around and do whichever way you want to do. Okay. This shows that the skin outside and the outer layer actually is just when the market they're cooking, they just peel off the skin and throw it away if you've seen, because they only eat the meat. Yeah. And you can start seeing a nerve. That's a nerve.
Yeah.
That's a nerve.
Yeah.
Probably sciatic nerve. The leg going to the neck. You can find all these things in if you just Google YouTube, you can find some of them showing these things.
Make sure you put a TMI if sending it to the group.
Pardon?
If you're sending it to the group, I said maybe like warn them first.
Oh, yeah. One day I was doing a lesson like that. One student fainted. And then, so the whole dissection was disrupted. They all were attending to her. Then I asked her, what caused you to faint? No, she said, sir, the way you cut, I couldn't take it. So different people are different, right? Yeah. That's why in medicine, if you're studying, you want to become a surgeon.
I have to see this.
You see lots of this and yeah. Every now and then you have to adjust these things so they can, as you cut open, you can see now I touched the blood vessel, so there's a little bit of blood. Sylvie, you can get more cotton for me, please. Thank you. Okay, now the next part is to take this, right? You actually shouldn't use, sometimes these days they have all these scalpels with blades. So the original one is removable blades. They used to have normal one without removable blades. They sharpen it to use those days, right? Now it's faster, so they're disposable, they just throw it away. But this is not so good in a sense that if I touch now, I should do this carefully, slowly. It will, the blood vessels in the skin may get cut. You know what I mean? So sometimes you say, just do like this. To do it very, a blunt scalpel is good. You know what I mean? In that sense, lah. So now I already cut the inner membrane, the tissues are starting to come out. Now I also have to pin this down because I don't want this to disturb my
It's like the thing of fish,
Yeah.
It looks like chicken.
I know, forget. I don't want to like this because it's too tedious for me. Don't worry.
Have you tried frog legs before?
Okay, now see I touch the vessel. I cannot help it because it's on the skin.
Texture of fish.
I'm not exotic people.
Thank you. Pass to me.
Actually, no, these frogs. Those frogs are not considered that exotic anymore.
Afterwards, I will fill it with what you call water. So then all the organs will float up. Then it's easy to see the organs. Thank you. You know, all will stick together. Yeah, somebody just asked me why I didn't wear my gloves. It's a good thing. I mean, if you are careful, if you are what you call following very aseptic techniques. I've been doing this for many years. The glove is a hindrance for me. Okay, I'm not doing this as a aseptic like a surgery to keep it alive. That's different thing. Then of course I have to do.
Expose kids early to stuff like
Yes.
this. They'll get desensitized to it. That's how
Yeah,
serial killers are
blood
born.
Do they have blood types?
Pardon?
ABO?
ABO, I think for us, they may have blood types. I'm not so sure about that one. You can probably check Google. These days, you Google all the information. People have saved you a lot of trouble. They've done all the work for you.
Yeah.
So that's how you should be. Your phone and all is a tool to help
Yes.
you, and that's how it should be. It shouldn't be something that you have got no control over. Today we're having people problem with handling technology. Huh?
That's right. Yeah.
So that's why I said you don't have to kill a frog. You can see the whole thing in YouTube.
Yeah.
In fact, many people have resorted to that. They don't allow dissections
Right.
in many countries. But I think occasionally I am only doing this for the purpose because I'm a zoologist and I'm using this to teach students so that they know, so that they appreciate what life is all about. Thank you. You see the because I touched the vessel already, the blood is coming out. I will wash it afterwards. Then you will. That's why I said I don't like this new. Sometimes the new things are not so good for. Unless I have a blunt knife, a blunt knife which I can without slice cutting. Can you pin? I think pin. Yes, put a few. Get some pins ready.
In the lab assistant. You think we can check if it's a male or female or if we dissect it?
Once you open inside, you'll see. Of course, it would be nice if not to show wear gloves and all that, but it is slippery and it's not so. Yeah, no, it's hygiene in the sense that, but it's difficult for me to do the one I don't. I want to do this fast. Yeah, you just have to be. Sometimes we become so. This one we take for granted. Again, that can result in problems as well, right? So you just have to be aware. Thank you. The original dissection when we study, when we're doing our Cambridge students, we call it from 6th year in Malaysia, that is pre-U. We have to cut out the parts, take out, stick it on the exam paper. Will you believe that?
Yeah.
So that you don't memorize theory and write down some information. So you cut and then you measure the length of the intestine or what, they'll say cut out the heart. Can you imagine that time? So they air flown here the paper, finish, they air flow it back to sun. So you have all this. Of course, they do some. They have the people who are trained to do the marking. They will know whether. And this one now they've done away with all that because it's just too tedious. You're not aware. Okay. Yeah, it always happens because after some, when I stretch it after some time, that's why the wax tray is important. Okay, and then now see, I want to make this clean a bit by washing this now. I'm going to wash this, the blood away, then it will become easy. Excuse me.
Okay, second layer.
It's very decent, it's a bit slippery. I see. Put something sharp.
Maybe you can use these first.
Okay. No, that's the scissors. Yeah. It's a different kind of scissors. I can make one slit with it. Enough for it. And now you remember some of the curved scissors we were looking at. That's one that assists in cutting certain parts we were looking at just now. Small scissors. Actually, this one I want to cut straight, not curved. But I want to let you know that as soon as I put in all the intestines, see, they were all the organs were all intact in place. When open, all start to come out. So all are being kept, neatly inside, packed inside. It's the same for human beings as well. Okay. And when I put the scissors in, I aim it upward. I don't put this, then I'll damage the tissue. Okay, so you can see the intestines already. Okay, here there will be a xiphoid cutlass near the rib cage. So I don't want to cut that. I'm trying my best not to cut it off because then I can't show this part to you.
Mom will be happy for me, but she won't be happy that she's seeing it. She can't see.
Okay, there's a sternum here. breastbone, sternum.
So frogs don't have rib cages, right?
They have.
They have.
Yeah. You can see the flaps.
I think all vertebrates have rib cages.
If they breathe by lungs, usually they have. The heart is kept inside carefully, and then protected inside carefully. The heart and the lungs are protected carefully by the rib cage. See now the keeps coming out. This happens now. Do what? Sorry, saying something?
Oh, no.
Is it possible to use soft board?
No, too hard.
Too hard.
Soft pot is too hard. I think the best is, they have done away. I mean, I had to keep this. This is more than 20 years ago. I have been keeping it in the lab because if at all I want to do the section, I'll be doing some dissection recently.
Look, it's lungs and intestine.
The wax board, you just use your, what do you call that, candles, right?
Pins. I mean, what is that? Sorry.
Candles there and then you just,
Candles?
candles and just,
Yeah, paraffin wax. You can buy separately paraffin wax. This is paraffin wax, it's not candle wax. Lah. But it's like candle wax.
but basically you just heat it up and then just,
Yes, it's paraffin. Correct, basically that.
Just compare with
is that
that.
expect the white yellow thing?
Fat.
Yeah.
But this is not this one not fat, this is intestines. I think I have to move it around and I will tell you
With
that.
fried rice.
Could be fat. Let me move it around first.
More Asian.
I think you should put like a trigger warning. NSFW.
May I ask?
Yeah.
18 to 19 this year.
You don't see the leg.
This is a female.
No, 1 year older.
I can tell.
It's a female.
How will I tell?
So another.
Oh, you know it's a female?
Eggs.
Oh, I see.
Formation.
Where the eggs?
Yeah. I'll move it away after I show you. Huh? Yeah, that's the purpose why we want to do this, because we want to see the heartbeat. Okay, now I'm trying to, this one I have to do carefully because I want to show you one important organ. Not important, but it's quite a typical thing. This is the sternum, right? And this particular one is called the, I recall it's called the xiphoid cartilage. I'm not touching a lot. To go above because there is this muscle here, and underneath is where the throat section. So I have to make a slit here and I have to kind of pull it open, then only I can show the other parts. So now upper here muscles are here, which actually block my view here. I can cut it off actually. Cut this, then I can go. What I'm doing is I'm slitting here, the stern part, so I can open it up. And the way to open it up is,
Heart is underneath it.
yes, there the heart is beating actually, you want to see it. Where is this? I actually wish I brought this seeker. No, it's a flat, like now I'm just show you. There the heart is beating. No, it's in the dissecting kit. No, like a spoon.
Yeah.
Flat one, that's called that. Okay, I'll open up later to show you the heart. The heart is beating. Can you see?
Oh, it is.
I can cut this off because it's not so important. So you can see it clearly. I don't want to touch because this is very careful. I'm doing quite fast. You want to show it carefully. Dissection takes hours because you don't. Once you nick the heart, then you start to bleed. Then it can difficult to see. Okay. Actually, I'll throw inside the plastic. Okay. Now I'm going to fill up with water. Now you'll see all the organs will float. You can see the. Can you see the heart is beating? Yeah. Okay, this is fat. All this is fat. What is this?
Sorry? Oh, that's a stomach.
Stomach. That's the stomach. Yeah. So you can see you can see all the what they call this. I want to look at this. I know these are eggs. These are eggs. So I know it's a female. This is egg. Okay. So what do you think is this? This is something that's eaten that's now right in the unfinished area. It's going to be the feces that will eventually will come out. Sometimes we will do what we tend to pull this out and pin it so you can follow the trace of the one. You know, this is hepatic waterway. Are you familiar? The way you absorb the nutrients from the small intestine.
That's a small and big intestine.
This is a small. And it's spread all over, as you can see, spread all over to absorb from all the sides. Can you see that?
Absorb the nutrients.
Yes.
So you see that sac that's connected to the intestine, like all around, like it forms like kind of like
Yes.
That's where when food is going through the intestine.
Because the intestine is long, so you have to absorb
Most
from
of the
all the
absorption
parts there.
happens in the
So the whole network of blood vessels, can you see the whole network of blood vessels is like that. So you have to unravel. It's easier to do with the hands. Huh?
All coiled in nicely.
Oh yeah, that's why I say, when all packed in nicely, very neat, there is some superior intelligence that's putting all this in the right place. We have to appreciate that. That's the whole purpose of the whole thing. So you
The white
see,
stuff that's floating.
fat.
Oh, it's not fat.
It's fat.
What about the liver? Is it the
Oh,
part
that's the
that
eggs. That's how you know it's a
Pardon?
the liver? Where's the liver?
Wait, I'll show you. I have to move it and I'll show you. Actually, I think that's the liver, but let me confirm. I'm putting it up nicely. So normally, if you use your hands, it's easy because we cut the intestine, you'll cut it off, right? So sometimes these things are easier to do when you do it, and it's coiling and turning.
Henry. It turned out to be a Princess Henry.
That's a handsome name for a princess.
We are trying to sex out from external. Some animals cannot be sexed from external. So you see, this is the. So you are right. This is the what you call the cecum, the last part before it's going to come out as feces.
Cecum or rectum?
Rectum, sorry.
Rectum.
Cecum, yeah, before the rectum, sorry.
It's like a spleen.
Yeah, I'm trying to identify which is that.
Oh, no wonder the other day when you're doing it was so smelly, right?
Of course, it will be smelly. You can open up inside.
Because I think it
Whole ass
bursts.
animals and humans.
Burst. You cut the open a reed. That's why you have to do it carefully, lah. See now, I'm trying to unravel the whole thing without.
That's the stomach, right?
Live.
Yeah, that's the
Like
stomach.
already opened up. In the science fair. Are you sure you're not? I swear you're. No. I promise.
Where was that? Where was that?
It was actually in a university.
Yeah.
It was a science fair in a
Yeah.
university. I forgot the university.
And they did that. They showed that.
They had humans.
Yeah,
Human
dissection.
like dissection.
Yeah.
And like preserved parts like of the
And
forehead.
embalmed. Yeah.
Yeah, all of them like actual
yeah,
humans. You can see
yeah.
also the face of them.
Yes, you can see that they've
Yeah,
got they've done now with all full skeletal system. You can tell like Dr. Monash has it. Monash University has it. The full, they give it a name lah, because they cover, they respect the person, they cover the face, but they show the until you can see all. They have this a technique called plastination. They kind of plasticize the whole thing, so you can see the real muscle, the real bone, the blood vessels. They cost thousands of ringgit, I don't know, hundred over thousand. They're only for medical students to see and study. And study. Or you on open day like that, they may open the place for you to go and see. There's a male and a female to show the difference.
Yeah, I think there is.
Yeah, in Monash there's. I've been there, I've seen it.
Yeah, we've seen that.
Or open days they will show you now. Okay, now so there's the stomach, there's the intestine coming down. This is the full block. Everything coiled down, and then that is the. You see the coils all?
Doesn't it have a big intestine?
This is part of the what they call big intestine. This part. Now it's filled with. This is feces. This is filled with the this is feces. Yeah.
Is it having
Going down.
constipation? So much.
No, probably it's. I don't know what they fed it. Where they probably they gave something to eat, crickets or something. They've eaten. When they're keeping it for restaurant, normally they don't feed it much, but if you have to keep it longer, probably they feed it. So all these are fat. When you see when they come, all these are fat.
What is the round, small little thing there? That, yeah.
This one, I'm trying to identify it exactly because it looks a little bit like, for me, what you call the gallbladder can be seen quite clearly. It will be colored. So I think it could be the spleen. That's why I also trying to verify first. Simply don't see until I know for sure. These are definitely the lobes of the liver.
Oh, that's the liver.
Okay, so you will be here, that's a gallbladder.
Why?
That's, can you see that?
What is
That's a
that?
gallbladder.
That's a gallbladder.
That's the one. So the other one could be the, what do you call, spleen. That looks quite small. See, every time you open up animal, I find that different animal is different. See, the heart is beating. What happened? What happened? You dropped something.
The other day we saw the one was like brown color. The liver was brown color. This one is green color.
We have to say the condition of the animal, we don't know. See, I want to see if I can pull this open so I can show the paper. It's quite hard. Okay, open it. Now it's clear. Can you see now?
Oh yeah.
Okay, that's
Let me
it's very slow actually.
Put it closer.
Where exactly is the lung?
Yeah,
It's behind the liver.
yeah. I have to move it to show you. This is the lung. This is the lung. Yeah, that's why I said if you actually have a tube, you blow it, you'll inflate. That's how you can see. You put through the mouth. They didn't bring the set where you have the tube. It should be a narrow tube.
Yeah.
Then you put in and you blow, the lung will inflate. Then you know this is the lung. This is the lung. This is the lungs. These are the lungs. Is it there? So this is the liver. Yeah.
It's really very big liver for
Can
an
show the
animal
lung
size.
again.
So.
Close more.
Huh?
Close
Correct?
up lung.
This is the lung. That's the lung.
Oh, okay.
So what is closer to the this one, the liver will be your pancreas. Sorry, gallbladder. That's one. Can you see that? The gallbladder. This one here. That's nice. I have to move it around to show. That's why I say it's important. You all didn't know that time. You put water, you can move it around easily. That's a gallbladder.
Gallbladder. That one.
That's a gallbladder.
That's a gallbladder.
Attached to the liver.
Yeah, attached to the liver. So one of the things normally we do so that we don't confuse, we'll cut away all the fat. Because fat blocks everything. So normally we take it all away, so you can see all the other organs clearly. Yeah? So you can just cut it out. This one cut out nothing, just fat. Why the fat is? Of course, you're surprised. See why the fat in this kind of lobes-like thing. Until now, I'm not so sure. I don't think we can say that we know, but actually, do we really know? That's the question, you know? But carefully cut away all this fat away. Yeah. And then, where is the plastic bag just now? Where's the plastic bag? Bring the plastic bag here. So all the things throwing away. Yes. So take this.
That's a fat also.
Yeah, all is a fat.
A lot of fat.
Yeah, it's not fat storage now. Normal, this is very. I think it's quite normal. I've seen even more. But then they didn't show that. Oh yeah. Especially people who are the heart all will be completely surrounded by fat. People can see that excess fat will be stored for. Sylvie, do you all take any pictures? Pictures? Did you take?
We have have taken some.
Okay.
Wait, hang on.
Okay, so this is, you want, you can cut out the this one also, eggs, so you want to see clearly. I'll take out all the fats first. See now, if I want to do this with my gloves on, it can be very difficult because it's slippery. That's why I feel more comfortable when I use my hands. Now I'll just, after that I make sure I wash my hands properly. Can you see now? So stomach. So before that goes there, the what you call duodenum. So all those parts you can start to identify. Yes. If you pull out and unravel the intestine lah, which I've done here lah, pull out like this, so I can get the whole range, this whole coil. I don't need to uncoil it. In the exam, we will have to uncoil this everything and measure what is the length. They'll ask you to make sure that you are actually doing it and not simply from theory. You can memorize and write the one you do. That's what normally happens. Okay, so I think now we can do one more wash. Okay. See, slowly getting a hole. Be careful, because of a hole. If I cut a hole on the intestine, then you can get all the smell coming out, right? Some tissues, must be careful. If I cut like that, I cut open here, I can see until the end where it goes to the anus. But I have to cut this in between and open it up just I did like this. Then I will be able to see the end where it comes out into the pieces. So at least you have an idea what it is they normally do when they did. Okay, important things like kidney, all you must see, right? It's all behind. So I probably have to.
How many kidneys do they have?
They do. They got two.
Two also.
Yeah. I have to move it around. Okay, it's below here. Too many things are blocking. I think it's below here. I have to cut this. If I want to show you the kidney, I have to cut this. Because kidney is right at the back. Okay. Sometimes when you do it depends. You cut to show what you want to show. You want to show the digestive system, or you want to show the reproductive system, or you want to show the renal, the urinary system. The frontmost one is usually the bladder. When I cut this, the frontmost one, I think related. This could be a tissue, but the bladder will normally be here. Although this is quite a big frog, so it's quite difficult to see, right? Imagine if you cut a small frog, very hard to see. Okay, now let me see if I have to cut this. Most probably the uppermost big thing will be the urinary bladder, and normally at cutting time you tend to cut away the bladder, because it's not like a nice round ball, it's thin tissue. When it's full of urine, then you can see big bladder and yellow liquid. You can see that. Depends. This is urinated already, so there's not, the bladder is small already, so you don't see that much. Yeah. So if you take your time slowly, look, then you can identify all the other parts. So that's definitely, this is the spleen. This is the spleen. Okay, this is definitely the spleen. What's the role of the spleen? Do you know? What does the spleen? We have a big spleen. Yeah, we have a big spleen. See, very small. This small spleen. We have a very big spleen. For human being, the spleen is like a reservoir of blood. So actually, they spare blood like that, like a big waiting. Because there don't seem to be other. You just Google spleen. Google spleen and see that, they'll explain to you. So
Releases red blood cells.
all blood. Red blood cells are floating in the fluid. The blood is the whole thing. Did you see? Can you see? No Wi-Fi. Then he will tell you. That's a general understanding. So far, we are human beings are not perfect. We don't know so fully. We know so fully. General things we know lah. That's not fully. I'm going to do it. I'm going to pour away and fill up one more time. Got enough? Spleen? Tell what? So we're sticking all the parts together. So you have to slowly take out the membrane, then you can see what you want to see. So it's not so straightforward, all waiting ready for you to see. It's all packed up nicely. So when I open it up, it will stick together. So they'll have to, what you call, we will put water. In human surgery, what do you think they put in? The air. There is air to push those things apart, inflate air, so they all fill up. But they have to remove it. So there's a lot of, actually surgery is a very, very skillful job. So surgeons are paid so much. their hands are this one, they are so precise. They say you should be able to put a knot with forceps inside the size of a matchbox. You should be able to put a knot. So you can see the skills, So that's why surgeons are highly sick, because when they need this kind of one, but it's a skillful thing. It's a very skillful thing.
In the ovaries? All these are
No, this is not, if it's not what you call pregnant, you won't be able to see the whole thing will be very shriveled and small. It will be very small. This is egg. This no. The egg is right now it's not.
okay.
So if not, you can see the feet, you can see the babies inside. You'll see, you'll be able to, when you get a pregnant one, not a release is this one, what you call the fertilized this one, you will be able to see. I see in rats lah, but very hard to see right? Rats, you can see the whole uterus with babies all there, just before
But
birth.
this one I thought is laying eggs. They lay eggs, right?
So fertilized already, so you won't see, but the part of the one will be like shriveled very small. See, the thing is, like, it is there, but we don't know the function, what is there. Sometimes very small, we don't know.
Exactly.
That's why I say we don't fully understand everything, but we try to do the best lah we can. I
Like
see
when they dissected the fish, they saw a smaller fish inside the stomach.
eaten lah, eat us. They eat, so that's possible. I dissected inside, I found an animal inside also.
Yeah, we thought it was a baby, but I mean, not baby.
Probably fish
baby.
lah, probably frog
No, fish.
What?
Fish.
Oh, fish. Fishes, they eat small fishes, so you see a lot of stuff inside.
Yeah.
I remember when I did the fish dissection, the tilapia, big one, the gallbladder was so big, Then we were doing. The student was doing. Suddenly, guess what? I think she's pressing like that. The gallbladder burst. The sting, the green color splash on everybody.
Oh dear.
And we were laughing at the fun time cleaning it up. But yeah, sometimes things like this can happen.
The worst is when the feces come out.
Yeah,
It's smelly like
yeah. They lay eggs, so you probably don't see this. It's going to take me a long time to slowly remove all the parts. I think this is the bladder. This is the urinary bladder. I think this is the one. This fine thing, can you see? I think that's the urinary bladder. So it's not as simple and straightforward and easy like you think lah.
Kidney?
Yeah, I'm trying to look for the kidney now. Hold on, I have a feeling that this is the pancreas.
Pancreas is green color, right?
No, not really.
Not really.
This the one. This the one.
Textbook
Yeah.
is usually green color.
Depend, because you're talking about a drawing which, that's why I said the drawing and reality is not the same.
that's right.
Gallbladder is green.
Oh, okay.
Pancreas is just a normal forest below the what's going on. Not real tissue. Not. This is depend. You see the location, you will know what it is. I have a feeling this is the. Maybe it's still part of the intestine. It's all coiled around everywhere. I'll cut off the eggs then maybe I can see maybe. Heart is still beating. I just cut the bone of the ribs.
Is it useful to have this cutter?
Depends lah what you want to see. I want to show that carefully, I want to move this carefully. Scissors not strong enough lah. That depends what you want to do.
Chicken?
Of course with cutter easier lah. Bone, if you cut the bone, see I stretch so long. I think slowly stop beating. Still beating very slowly now. Now what we can sometimes do is you do all dissection, all keep, then you take hours, do properly and keep, then show all the parts one by one that will be, because it's not easy to show everything clearly. You have to cut away the connective tissue which is sticking to it, all we have to be careful. So as far as you can see the main ones, I think it's okay lah, the main parts you need to know.
Why is there a difference in the liver when it is brown and this is light?
The one very hard to say. The color of the tissue very hard to say. Maybe it can be lighter, can be darker. I also opened a few times. Some is lighter, some is darker. Maybe I think depends on how long, how you kept, maybe how long you keep the thing. Is it natural or was it what you call these are these two are the things. Let me show you here. This is diagrammatic. That's why I say it's not the same.
Do they have diaphragms? Do they have diaphragms?
Yeah. I have to cut to the sternum already.
Okay.
So underneath here, definitely if they have lungs, they will have diaphragm too. Rats can see it very clearly.
Because the day they cut, they saw something like diaphragm, right?
Yeah, below the pass through there's some pass through. See whether when the pass through here, I just cut the rib cage in order to open this, so it will be there in the place.
Answer any questions. You're not sure they ask me, is it a diaphragm? I say,
If they have lungs, they have diaphragm. Because the lungs, diaphragm helps to the breathing in like human, but what you call, it may not be distinct in a frog because he can breathe in so many ways, skin or lung. In a mammal, very important that's how they assist air go into the lungs by the diaphragm. But they could be very diminished so much so that they cannot see. Like for example, I think this is the left and right kidney. They are coiled. It's not like our typical. They show here some picture, but it doesn't appear to be like this. So this is a diagrammatic thing. I don't, just a guide only this one. It will not be the same. You take time and slowly pull off all those little bits, and then you can see that is a nerve.